Burn prevention and first aid. Some workers perform tasks and use chemicals that can put them at risk for burns. Around 1.1 million burn injuries require medical attention each year. There must be one worker on every shift trained by your company on how to give first aid. Know who is trained in first aid and do not respond above your level of training. Burn hazards include hot metal, flammables, and exposed electrical circuits and wiring. Certain work tasks increase your risk of getting burned. These tasks can include using flammable and combustible gases, liquids, or vapors. Doing activities that could create static electricity, using tools and electrical equipment, and doing hot work and electrical work can also increase your risk of getting burned. Wear flame-retardant clothing when required to reduce your chances of being burned. Wear leather gloves to handle hot materials, and keep clothing and tools free of flammable materials. Wearing cotton rather than nylon or polyester materials, and being aware of any welding or cutting operations that could pose a fire hazard are also ways you can reduce your chances of being burned. Workers can receive several different degrees of burns. There are first degree, second degree, and third degree burns. First degree burns involve the top layer of skin and cause redness, pain, and mild swelling. Second degree burns involve the first two layers of skin and cause deep reddening of the skin, pain and blisters, a glossy appearance from leaking fluid, and possible loss of skin. Third degree burns are the most serious type of burn and involve all layers of the skin. It can cause permanent tissue damage. Signs of third degree burns include the loss of skin layers, a lack of pain caused by skin damage, dry and leathery skin, and charred skin. Patches of white, brown, or black skin can also be a sign of third degree burns. Burns are grouped into two categories: minor burns and major burns. You can have more than one type of burn at a time. Minor burns are first degree burns anywhere on the body and second degree burns that are less than 2 to 3 inches wide. Major burns are third degree burns, second degree burns that are more than 2 to 3 inches wide, and second degree burns on the hands, feet, face, groin, buttocks, or major joints. To give first aid for a minor burn with unbroken skin, remove the injured worker from the source of the burn. Then, loosen the clothing around the burn and cool it immediately with clean, cool water for at least 5 minutes. Apply a clean, dry, sterile dressing. Major burns require medical care to prevent scarring, disability, and deformity. Get medical attention as soon as possible and do not attempt to treat serious burns unless you are a trained health professional. Work cautiously to prevent burns. Wear appropriate PPE and follow safe work practices. Give first aid to burned workers only if you are trained. Call for immediate medical attention for serious burns. Stay safe.